Now, on to a few introductions. My name is Kevin Durgeon, and I am an acupuncture practitioner based in South London. And I'm absolutely fascinated by the huge scope that acupuncture has to help our cancer patients. And I firmly believe that our skills can help to transform the experience of patients all along their cancer journey. There are, however, very many of us who don't feel confident enough to work with cancer patients. And that's why I'm so delighted that we're joined today by Dr. Yair Maimon, who's going to help us to dispel some myths about working with cancer patients and hopefully to help us to start to build our confidence when we're working with this specific group of people. I'd now like to say a few words to introduce Dr. Maimon. He's an internationally renowned figure in the field of integrative and Chinese medicine with over 30 years of clinical, academic and research experience in the US, Europe and Israel. He integrates complementary and Western medicine. He founded the TAL Center, an integrative cancer research center. He's president of the International Congress of Chinese Medicine, and he's also the president of the ETCMA, the European TCM Association. Welcome, Dr. Yair Maimon.
Hi, Kevin. Thank you for this warm and lovely introduction. Thank you very much.
Well, I'm thoroughly looking forward to today. Let's kick off. I've got a couple of questions that I think that we'd all really benefit from. I'm fascinated to find out more about what interested you initially, what got you started in the world of oncology acupuncture. And I'd like to know about how confident you were about treating cancer patients right at the beginning of your journey.
I was introduced to oncology acupuncture just actually by chance. I didn't, it was back in beginning of the 90s. I went to China. I felt that my skills after studying, actually I finished 4 different schools and more. And I still felt, I want to learn more. So I learned to study actually more skin dermatology in China. And my doctor that I was studying with him, the dermatology, went for a few days. I went to study with an oncologist who was in the same hospital in China. And I stayed with him a few days and I was surprised. I was surprised to see cancer patients that normally we see them very withered, very tired, very, kind of harsh looking. I was surprised that in his practice, most patients just looked great. They felt great. They were looking good. Some of them were even pancreatic cancers, so even more shocked. And then I remember flying back home in the airplane saying, I was told you should treat everything but cancer. Okay, so I was really, if talking about fear from cancer, there used to be this myth, and cancer is full with myth, as we will touch on it today, that you shouldn't treat cancer with acupuncture. And there was different ideas behind it. So at school, at least back then, they would say to people, don't treat patients with cancer. And I went back home and I said, this patient really, they are the most needed one. If we are really looking at, especially patients who aren't taking different oncology treatments, and if we can help them so much, we should do something about it. So I went back more and studied, even brought specialists from China who worked with me in my clinic for 8 years. And slowly, I kind of gathered more and more skills. But I think by now, I've kind of course, I feel more confident, but I just realized, there's this fear on one hand, and on the other hand, we have amazing skills that probably everybody who is watching it and is an acupuncturist pretty much has abilities that, if they were maybe specialized a bit more or just do something a little bit more, they can help this patient. And unfortunately, it's a growing population, it's a growing need, and our vision as being a physician is to help patients. And this is a group that we can help dramatically.
So when you started out, did you, so actually starting out treating cancer patients initially, how happy were you about using your skills to help them?
I was very nervous at the beginning. uh, but I think the most rewarding things about oncology is that you see results almost immediately. Because patients are coming very deficient, especially during treatments, and they're very weak. And even with the simplest tonifying treatments, they just really transform. The other main issue in cancer, and as we talked as a myth, is also the Shen. People are coming with a lot of fear and very fragmented sometimes in their emotions and in them feeling as they were before, so to speak. It's a very transforming time for people to know that they have such a disease. And acupuncture is one of the best tools for me to bring calmness to the heart and recenter you. So these two ends that we can help in that very specific moment. I mean, later I'll divide maybe patients into different times when you meet them. But I think this is two skills that we have, and we have them so strong already. I mean, if you're trained as an acupuncturist, and it's just a matter of fine-tune them and getting more maybe core competence, but really not being afraid of it. I think that's the main message that I want to pass through. Cancer patients do need us, and it's, I don't know the proper word. I won't say it's easy to help them, but it's not as difficult as you would think. Even just doing sometimes kidney 3 or kidney 4, you see that the fear changes. You normally you have quite healthy patients, and I don't know, or with more minor disease. And in oncology, I think, again, this is one of the things I always advocate, is using very few needles. And if you want to start very simple. Again, we can grow in it and do a lot of things, but the main idea is also to do simple treatments, start very clear in your mind what you want to achieve in the treatment. And to me, this is, as I said before, one of the situations where treatments are rewarding. I mean, I get patients coming without appetite, going with appetite, coming with fear, going a bit more close to their inner self. So this transformation happens, I find, in cancer. We are mainly now talking about cancer patients during treatment, but actually I'll later talk about, there's like 3 different groups. I would say patient who had cancer, I can address them differently. Patients who are during treatments or recovering, they're in second group. And patients who are living with cancer because of a metastatic disease or some other chronic cancer disease, that are like a third group. But so at the moment, we are more talking about the patients who are just coming during treatment when it's this most dramatic. They will be the first one who will usually seek some help during that point.
What makes TCM and acupuncture treatment so effective at helping our cancer patients?
I think it's the phenomenon of Qi, actually. Most cancer treatment are very disruptive to the Qi. They are toxic one way or another. I mean, if we go through the whole scope of treatments, this is one of the times that we almost think about Western medicine goes a bit like homeopathy, likes cures likes. We won't go now into what is causing cancer in Chinese medicine, but definitely toxins is one of the main issues, and they're treated with high toxins in Western medicine. And one of the things that toxins are doing is they're disruptive to Qi. They're against life. They're against the normal flow. And I think in acupuncture, we are bringing back a natural flow to the Qi, almost with whatever we are doing, especially if you're a skilled practitioner who can focus on the patient, and be in touch with their own Qi. And because their chi is so disrupted, and you do a simple treatment and you bring it into motion, I think this is, to me, one of the main things. And there's been an ample of research. This is one of the most researched area. It's very surprising.
Now, I was amazed. I was amazed by the sheer volume of research there is and the quality of it. Yeah, would you be able to please give us a very broad outline of the evidence base for oncology acupuncture?
Well, I'm actually working in the last year on a book, which brings the evidence for oncology acupuncture, and trying to kind of bridge the gap between most people who don't like to read research and then practitioners. First of all, I'm a practitioner of Chinese medicine. I'm lucky to be a researcher and teacher, but first of all, as I said, I'm a practitioner. So I know there is a gap between all the research going on and what people are actually disseminating into their own practice. That's why we are now looking into literally hundreds of research in oncology acupuncture, hundreds of published articles in oncology acupuncture, and the scope is enormous. Just to give you the idea, so there's now meta-analysis, a few meta-analyses that are encompassing more than 17,000 patients in each. So they are taking a lot of different research in one specific area and looking at them from top down, analyzing everything that you analyze in review of literature. And basically what we see is amazingly good results. Again, most of the focus is side effects of Western medicine, but it's not just. So in problems like fatigue, for example, fatigue is about 90% of cancer patients are fatigued. Mm. And being fatigued, when we'll talk before about the scope and disrupted chi, you know how you feel when you get up in the morning and you can't get up during the day, when you're fatigued all day long. It's diminishes your shen, diminishes your ability to deal with pain, with any discomfort. So fatigue, there's been a lot of research on fatigue. There's been, later I'll bring maybe a whole list of what we are kind of even teaching online and streaming, and so it will help me to remember. But there's a whole huge bulk of research on nausea and vomiting, on GI tract generally. There's even very interesting research on dry mouth for patients who are getting radiation for head and neck treatments, cancers. There's research in side effects of Western medicine, such as hot flashes. Even immunology, reduction of white and red blood cells.
Now, we've got a question from Justin. Hello, Justin, by email. Justin writes, I have been anxious about treating cancer patients. Is it safe to use acupuncture with conditions such as lymphedema? And do you need to have patients WCC checked prior to treatment?
Okay. So again, just to focus the conversation, we are mainly talking about patients who are undertaking treatments. Later, I want actually to get the chance also to talk about huge group of patients who had cancer. They're normal people. We just need to address maybe some things differently. Let's start with contraindications. I like to call most of them as precautions. Of course, there is some contraindication in cancer in acupuncture. Acupuncture has, above all, been found safe. One of the things that's the good when you have a big bulk of research, even from a Western standpoint, what you're trying to prove is safety and efficacy. We know it is safe, but now it is proven that it's safe. So we need to be cautious in different situations. Lymphedema is, by the way, one of them. Lymphedema, for people who are maybe not so tuned into it. So usually when there's mostly it happens with women, but it can be other conditions where a group of lymph nodes were removed, let's say because of breast cancer. So there's less good flow of lymph to the head, and the head hand gets swollen, can be another limb. I normally don't treat or do acupuncture to the lymphedemic limb, but will treat the other limb, and then it will help. Lymphedema, by the way, there's been some research that we've shown acupuncture to be effective. I must say this is one of the conditions that for me in the clinic is not my top priority for acupuncture. I usually recommend lymphatic massage and some other means, which I think are extremely good. But on the other hand, if you increase the spleen chi, if you treat the other limb or the crossed limb, you definitely help this hand. And another great thing for lymphedema is Qigong. So sometimes we are just in the place. That's actually, I think, one of the important things for me to say. Cancer patients are quite lost. They come to the hospital, I'm for integrative medicine, okay? And I work in hospitals all my life. But still, the hospital environment, obviously the oncologist, they are lost in it. They get a kind of Western treatment, but as we know, Western medicine addresses the cancer, not the patient. And sometimes the Chinese medicine practitioners is the first person who they can actually talk to and relate to and see, can bring them back the human part, as we see the 3 dimension of man being between heaven and earth, so bring back their own self or their ability to heal themselves and bring also back the confidence for them. So in this respect, it's invaluable. To me, I can see how patients are coming in and going out, and just sheer from that, we look at the personalized part. We look at them as human. And not as cancer, we don't see just the disease. So I don't know why I went on it, but I think definitely as a practitioners of Chinese medicine, you can understand we still treat patients. Cancer is a big word. Don't get lost with it, which you still treat the patient as you treat with other disease.
Yes. So you've touched on this already, Yair, but I wonder if you could expand slightly about, so an acupuncture practitioner will be one part of many, many, many different practitioners, from surgeons to all of the different specialists that a patient will see as part of their cancer journey. Where do we as acupuncturists fit within that very wide range of practitioners? And what is our scope? What is the potential for our involvement?
First of all, I think we really fit in every part of the journey, of the cancer journey. Maybe the only difficult part is from when the person is diagnosed until they are finally diagnosed. So there's this very dramatic part in the cancer patient's life, or a person with cancer life, from the diagnosis until the final diagnosis. So that's actually a time where nobody fits. I must say, it's just so daunting, and totally, everything is moving like in a, how do you call it, a carousel, or when you go to it's like, and it's very, you can do simple treatment to calm somebody, but that's the part of the journey. And that's, by the way, the part of the journey that everybody is blinded. The cancer patient, it's usually a short time. Then people are coming back to themselves. So during this time, I can say it's usually more difficult to treat. But other than this, our scope is enormous. Even the scope, and I would say potentially, we have to be careful with words, with prevention of cancer, with prevention of recurrence of cancer. I do believe that with acupuncture on a daily basis, we help to prevent cancer, or at least we have the potential for this. Because cancer it's not something that happens. It's a process. And if our immune system is correct and is able to see the cancer or the mutated cells or the initial mutation, then basically we prevent cancer. My current research is more on herbal medicine, but also I'm showing prevention of recurrence of cancer. So our scope is quite wide. Let's say from potential prevention to treatment during Western treatments to, again, after cancer, recovery stage. I'm sure that everyone has in their clinic patients who had cancer. You know, I mean, it's so common. I mean, a lot of cancer, you can really get cured. But then, this is maybe the most important thing I can say. We treat the underlying cause, not just the disease. So when you are able to address the underlying cause for the disease, then you're also helped in preventing, but also in strengthening the person.
Thank you. Now, the overarching title of today's webinar is Don't Be Afraid to Treat Oncology Patients. Yair, could you describe how we as practitioners can develop skills? What are the important skills that we need to develop within ourselves to enable us to best support our cancer patients?
I think it's, I see it in two ways, you know. If you fully want to treat cancer patients, we need more core competence, which means, especially Western medicine, we need to learn more about, because cancer patients are coming to us with their Western medical diagnosis, their Western medical treatment. They expect a practitioner to understand it and to know about it. So there's few core competencies actually that are lying, one of them in Western medicine knowledge. Another one is to understand better cancer in Chinese medicine, and maybe a little bit about like cautions and contraindications. Then you have, I think, all parts, all the needed parts in order to feel very confident. But if you want just to try and treat a cancer patient, I mean, especially if there was a patient that was your patient before and now is undergoing treatments, you can still do, I'll give you like a simple treatments. You know, I have, I would say I developed, or not just me, you know, with the whole group of people and also oncologists, we developed a whole program with two aims in mind. And one of it was to really give the practitioners all what is needed in order to feel very confident with treating any cancer patient. And the other things, I had the first time in mind that we need a worldwide program, that everybody around the world need to have some kind of basic understanding that we can share. We can move from country to country. We can talk with our peers everywhere and talk about, you know, the different aspects, especially in oncology. I think to me it presented a huge opportunity. But coming back to your question, because I feel I kind of talked a little bit more to the side, to the left and right. Not to be afraid is just to start. And if you want to get really skilled in it, then obviously learning more is what needed.
Thank you. Now, a couple of years ago, I made a film about acupuncture and how it can help with all sorts of different conditions. And I interviewed a Western oncologist. I was scared. He intimidated me. I felt so tiny next to this guy. Now, I know that for many of us, we're complementary therapists. And sometimes we can feel a little bit scared, nervous about working alongside Western medical colleagues. Yair, please help me build my confidence. What advice can you give to me that will help me to build up my confidence when I'm communicating with my Western medical peers?
I'll give you also a little story. I was the head of a complementary medicine unit. The second one opened in Israel in hospital. And I was actually I was very lucky. So I was very well received in most wards in the hospital. I mean, it's a whole different story. But the only one that refused me was the oncologist. And they were very intimidating. And this is one of the things that you have to understand. Their main issue is that you don't have evidence. There's two things you have to know with oncologists. One is to talk about evidence. And the second thing is to learn a little bit more about the language. Because, once you go through the first stage, you open the door, you still need to sound, okay. So you need to know the language. But as I said, with evidence, it's just one of, I can say, my pains. I'm very involved now worldwide in promoting acupuncture and promoting acupuncture as an integrative medicine and part of health. I believe we should be part of healthcare. In oncology, from all different scopes of practice, we have, I think, almost the most evidence. Maybe the first one will be back pain, but the second, oncology, I don't know how to rate it. And we have extremely high evidence in so many areas. Mm. And if you are able to study, teach yourself a little bit more about it. And I know we have different webinars on it. Again, from this point of view, that if you can speak the language of evidence in a simple way, then, we can really go, you can find a very open ear in the oncologist. I'll tell you how I do it. I have a secret, by the way, that opens, until now, almost every door in the hospital, including the head of the hospital. So I always say, let's not talk about acupuncture. Let's talk about intervention. That's the Western word, So, and for every intervention, we are looking at two things: safety and efficacy. So immediately, we are communicating in a proper way with oncology. And I say for safety, we have a lot of safety for acupuncture. And there's meta-analysis, there's review papers for safety. And then for efficacy, we have many studies. So for even diarrhea and constipation, I have patients during treatments, the only thing they're coming to me with is constipation, but it's mainly not due to the chemotherapy or other drug, but actually from the antiemetic drugs. One of the main best points is triple warmer 6. If we all have time, we'll talk about the triple warmer. You just do this point, maybe with stomach 37, 36, and immediately they're getting up. Because if you're constipated, you have less appetite, your abdomen is bloated, and you feel terrible on top of feeling bad, both from having cancer and the treatments. One of the things about the digestive tract, it has epithelial cells, which are changing very fast. All our digestive tract, in a way, it's one hose, which is changing. And most of the chemotherapy, but also other therapies are infecting this different parts of the digestive system. And acupuncture is extremely good in bringing back and moving spleen qi, stomach qi, zeng qi, the upright qi. As I said, even using simple point, your lung 9, stomach 36. You start with something. We can use also some herbal medicine. Immune system is affected by acupuncture. And it's it was proven in small scale, but still proven also in acupuncture. Peripheral neuropathy is now moving into phase 3 research in America. By the way, most of the big hospitals now are employing and having acupuncture in their facilities. And we in Israel, we have in all the major hospitals.
I was lucky enough to watch a presentation by Dr. Wei Dong Lu of Harvard Medical School.
A friend.
Oh,
Yeah.
he is such a wonderful, wonderful man, and oncologist, and he's absolutely fascinated by acupuncture. And they are doing so much research at Harvard Medical School into how acupuncture can help. And his real feeling is we need to basically up our skills if we want to be taken seriously, and also if we want to help as many people as need our help. We need to lift our game and elevate ever so slightly to give us that confidence so that we can communicate clearly with people,
Yeah,
both our patients and with
I
others.
know Wei Dong very well. I visited him in his facilities, and yeah, they've been. When I was talking about the immune research, it actually was his research, and when we say research, people have to understand. Until you've done research, you don't know how much effort goes into a research, and most of it takes around 5 years. And in this area, we have so much that it's, to me, it's very comforting, I must say. And if we are talking about talking to oncologists, I mean, actually today I would have said the opposite. If oncologists would say me, you don't have enough evidence, if they're trying to intimidate you. This to me a statement of somebody who doesn't speak the science language, because not saying you don't have enough evidence means I checked it and I didn't find, or I just have an assumption, and having assumption is not science. Absolutely. So, but as luckily I feel now a bit less attacked. I feel more that if we are presenting ourselves with the proper vocabulary and with the proper this is actually, I think, important point. If you feel a bit afraid, then it's easy, to make you fearful. If you feel confident in yourself and in your acupuncture, then you can manage. And also saying, I'll check something, I'll get back to you, it also sounds good. But I must tell you that I think one of the most important things for me, especially as a teacher, is to create this inner transformation, because people know a lot and they feel they don't know enough. Especially in Chinese medicine, people, can help a lot and they feel like, oh, I don't know if I can help.
But we still don't feel good enough. And it is an issue of confidence. It is an issue of just lifting and gently supporting our confidence, because our skills are terrific. Our skills are terrific. It's just that we find it so hard we find it so hard. The main fear that we face is that we will tonify the cancer cells and make it spread. And we will then face the risk of being pointed out as the cause of the cancer spreading. Dr. Yair, what is your view on this?
One of the myths about acupuncture is that we can spread cells and bring them into a metastatic, spread them around the body into other areas. First of all, it's 100% myth, okay? So, or to say it in a better word, it's rubbish. It was never, ever proven in this way. It was never, ever referenced anywhere in the way that it's possible. To me, if so, it's the opposite. And so I know a lot of fear is coming from this kind of myth that we can spread cancer. I wouldn't advise to directly needle into a tumor, a solid tumor, but I think it's sensible. But doing acupuncture, and spreading cancer cells around the body is something that somebody had put up this myth. I studied it in school. This was the reason why I was told not to treat cancer patients. But since then, literally, as I said, I've seen hundreds. If I can say, it's the opposite. There is really no scientific, logical, or any other proof to that matter. I think so. That's the bottom line. But it's viral. It circulates. Maybe even some teachers are talking about it. So if there's something that I feel very confident with, is that there's no way we are spreading tumors by doing acupuncture.
You okay? So we can.
Yeah, I know, but it's coming. I
off.
mean, I hear it many times, and it brings a lot of fears and stop many practitioners from treating cancer patients. But I say, so you be following up patients for years. If so, it's the opposite. That's like no other way for me to say anything about it.
Thank you.
And
Thank you.
I've never seen any reference, like a real reference to it, either ancient reference or modern reference. So, we should have seen some references to it by now.
Sure. No, I was just wondering, is there, like when you do treatments on people who are recently pregnant and stuff, because I've been doing a lot on infertility and things like that, just researching. Is there anything that is contraindicative if someone has had cancer or has cancer at the time? Is there any points that you just would not do? Any acupuncture points that are just not a good thing to do for people?
Again, can you say it's for pregnant women? I didn't get the beginning.
There's obviously points when you're treating someone who is pregnant that you would avoid.
Contraindication in pregnancy.
Yeah, exactly. Is there any that you would avoid for someone that's got cancer or someone that has had cancer, for instance?
There's like the simple answer and the complicated answer. Okay.
Okay.
By the way, I also, I'm an eternal student of Chinese medicine, and I also listened to a whole lecture about forbidden point in pregnancy.
Yeah.
And apparently also there is more a myth, so it's very much depends on the diagnosis, and there is no like one list from somewhere. It's again more precautions, etc. I would say one thing about my style, and there's different styles of acupuncture. I'm saying something very deep that needs to be expanded. That's the complicated part of the question, the answer, that some of the cancer is related to the wood movement. Like, I don't know from where you are in the world, but in my area, it's starting spring now. So you see how nature starts to kind of grow fast. And cancer cells, this is one of their characteristic, they're fast growing cells. So there's a lot of wood energy there. So I would be kind of a bit more cautious, I would say, about point, let's say, on the liver, tonifying the wood phase. And again, depends on what time of the cancer. So I think there is some fine tuning, but there is no one contraindicated point for cancer. That's the simple answer. I do think we need to refine our treatments, but there's no one contraindicated point. Sorry?
So did you say that you would or you wouldn't tonify the liver? Sorry, the sound cut out.
I would be very specific. Not just the liver, even the wood energy, because all the wood points, doesn't matter where they're dealing with wood. But that's again, that's like the complicated. I think that, there is a lot of fine tuning with patients, and there's a lot of fine tuning with patients, especially if they're taking a lot of toxins. So again, the liver is the one that is dealing with the toxin. So you have to take certain things into account, but the simple answer, there is no one point or list of points that are contraindicated.
Thank you. Yes, sorry, I know it was a difficult question.
Thank you very much. How do you deal with pharmacological interactions?
We are very lucky. With acupuncture, you don't have any problems. They will come up more when you're dealing with herbal medicine, but that's beyond the scope of this talk. I do a lot of herbal research, so address a lot of issues of herbal medicine and interactions, but we are very lucky with acupuncture. And that's why in all, as I said, in most hospitals, and I believed, and this is part of the idea behind this course, that it will be in almost every hospital in the West or clinic in the West, there will be acupuncture employed. To me, having oncology without acupuncture is really, it's a shame. Sorry that I'm not firing, but I'll give a simplest example. A relative of mine has just had cancer, had been undergoing radiation. For one reason or another, they didn't contact me. Suddenly they appear in the clinic after 20 treatments. They have 35 treatments of radiation. And he was so shocked, you know, that after each radiation, he was exhausted. And suddenly after the acupuncture, he said, usually I would drive home and just wait to get home to crash into bed. And every time I'm getting treatment from you, I'm coming home and I'm full of energy. So, you know, it is so simple and effective that it's a shame not to do it.
Thank you. Now,
but we don't have any interaction. That's the bottom line. So.
Okay, thank you. Now, we've got Helena Rodriguez. Helena, you've got a question. I wonder if Guy, you could invite Helena to unmute and to ask your question. Helena.
Hello.
Hi.
Hi, sorry, because I am not my camera on. Hello, Dr. Iyer. How do you manage when patients come into your office and are prescribed with lots of chemical medicines? My biggest affair are the interactions with the phytotherapeutic medicines.
So this comes back to the question before, you know, with acupuncture, luckily, and this is, I think, you know, coming back to the issue, why not to be afraid of acupuncture. We don't have negative interaction with acupuncture, and most oncologists that I meet are extremely open for patients to get acupuncture. You do have to watch, let's say, two things. You know, one is if the patient has blood thinning medications or can be easily bruised, that the platelets are very low, so you have to be very careful with the needles. Obviously, at some point, maybe not needle. And one thing we have to watch also during especially COVID time, that these patients are very low in their immunity, usually not immediately after the treatment, but 10 to 14 days after. So, you know, make everything you can to make them safe in as not sterile environment, but as close to sterile that you can. I mean, I'll give an example. In my clinic, you know, we immediately put them in the room. There's more rooms, so we don't let them wait in a waiting room. We obviously clean the room very well. So you do need to kind of be aware of it. But, and for phytomedicine, it's a huge topic, you know, I can't even start to address it, but basically we are quite safe there, much more than you think.
Thank you. Now, let's go to Dr. Sangeeta Bajaj. Hopefully I pronounced your name correctly. Could you please, Guy, unmute Dr. Sangeeta, and could you ask your question? Dr. Sangeeta Bajaj, would you be able to ask your question?
Oh, perfect.
Yeah. Hello, Dr. Memon. I have completed your course with oncology. I just wanted a little bit on, will you throw some light on blood cancers, about that herbal formula? How much is it effective in blood cancers, and about prognosis of blood cancers with acupuncture? Okay.
So it's two parts. So thank you, Sangeeta. I remember you were in one of the last courses that we gave, and you're from India, I remember. So the first thing, I'll start with acupuncture, then I'll talk a little bit about herbal medicine that I've been studying for years. So acupuncture for hematology, from cancers, blood cancers or hematological cancers, we can in very fine way with acupuncture tonify or bring to health the bone marrow. And the bone marrow is the main issue in blood cancers. So I find, at least in the clinic, that, you know, we can definitely help these patients. Most of them are also taking chemotherapy, then they have the side effect, and we can have the side effects as with every other cancers. I've been researching one herbal formula called the scientific name LCS 101, if you want to check. And we use it with the blood cancers mainly to reduce side effects or to help patients recover in the recovery stage. It's less addressing the cancer itself, but more addressing the side effects and then later recovery.
Thank you.
Thank you. Thank you.
Thank you. Dr. Yair, we've got a question in the chat box here from Miao Wong, who I don't believe is with us at the moment. How do we prepare our patients before the start of the chemotherapy treatment?
Again, it's a core question, and I'll tell you why. One of the things about cancer is that you're very alone as a patient. And I think one of the things that people need is people to go with them in the journey. So to me, and it took me years to realize that one of the things that you can prepare the most is to tell person you will be with them in this journey. And you will support them, and you will find how to reduce, you know, ease their pains, whether it's bodily or mind or you know, we can easily say Shen. But knowing that somebody will be there in their journey, I think it's a key thing. At different parts of this journey, different things need to be addressed. And I think we have the skills, as we talked about, to address at each part of this journey.
Thank you. Now, Miao Wong actually is here and has got another question. So Miao Wong, could I invite you to unmute yourself and to ask your question about Shen Men? Hello, Miao Wong, could you? Hi. Hello, Miao Wong, are you there?
Yes. Can you hear me now?
Yes. Ask your question, please.
Okay. Sorry. Yes, actually, this patient is my sister, so it's really at my heart. She is suffering from recurrent acute leukemia, and she's not near me. She's in Malaysia, and I'm in Sydney. So this is a very realistic question. So I don't know there would be a chance for her to get acupuncture, but I at least try to ask one of the family to use Vaccaria seeds for ear, right? So I thought it'd be easier to administer. So I thought Shen Men would be one of the point that at least that can be easily done. Thank you. Thank you.
Okay. Well, thank you for this question, because I think it brings two important topics. One, obviously, how international cancer is and brings people together. And to me, this is one of the main inspiration and motivation and vision behind the course, you know, that hopefully there'll be people from Malaysia studying, so you can easily refer, you know, to them over there. And I would like to point out that there's been some studies, especially on fatigue. I remember soon the patient who did this study, she's from Canada, that even massaging stomach 36 was very helpful for fatigue. Shen Men on the ear will be, I think, a good point to, as you mentioned to her, maybe to reduce some of the unease. Even just putting your head on Shen Men, you know, in tongue can be relaxing. It's quite amazing how soft touch on some points can bring the Shen back to the heart, and also on heart 7, Shen Men itself. So also, I was actually surprised. I didn't expect much from self-help acupuncture, but there's been some huge studies. I mean, with hundreds of people, it's easy to study. You get people to do some points at home. They were found helpful. There was one in England. I forgot the lady who did it. She was a nurse. We were on some congress together. And soon I'll remember the person from Canada. She's also a PhD nurse who did big studies for fatigue. But you can look it up if you put fatigue in acupuncture. I'm sure you'll find out in self-help acupuncture, you'll find her studies. She even developed an app for it. So you can look it up. In a minute, I'll have her name. But Susan Zick. So if you look at Susan Zick's study, and this is self-help acupuncture. So that's for somebody who is distant, or during COVID, somebody who cannot come to the clinic. And I know that she specifically developed an app to help it. So I don't know the name of it. I just by accident heard her speech. And so I think it can be also useful. She's like a great researcher. There's quite a few of, I'm part of the Society of Integrative Oncology, and I was lucky to meet a lot of researchers from all over the world. A lot of them from North America, I must say. There's a lot of research done there, but there's some in Germany, some in England. In Australia, by the way, I know two great researchers. You can also ask them. And again, Kaylee O'Brien is one of them in Australia. She's in the university there. And in a minute, I'll bring another name from Australia. So there's been quite a lot of international research in acupuncture.
Wonderful. Thank you. Thank you very much. Now, it's our official end time, but we do have Helen. Don't worry, don't worry. We're going to come to you because we do have so many wonderful questions, and thank you to everybody for investing them. We're going to keep going for another 10 minutes, if that's okay. So Dr. Yair Maimon, quick fire, energetic bursts of answers so we can answer as many of these questions as possible. Helen,
hi,
finally.
Hi, Kevin.
Hi, Helen.
Nice to see you. I have a question. My sister is going into CAR-T cell replacement shortly, and I do take care of her. She's 4th year ovarian cancer survivor, works 5 days a week, is very healthy. I think because of everything that we can do with acupuncture. She doesn't do herbs, eats well though. But is there anything I can do to prep her? And what can I do during the treatment? Because there's going to be cytokine nuclear syndrome, there is neurotoxicity, organ toxicity. Can I do anything? Because I'm going with her to Leuven, Belgium.
Well, I think we kind of, for all the things that you mentioned, acupuncture is effective. Obviously, I can't go through like all the points or options. So A, you can look at some online. B, obviously we are advocating to take a whole course and be an expert in it. So as you go along the course, you'll find you're gaining more and more skills exactly in these topics.
Okay, very good. Thank you.
Maybe just a simple tip. Sorry, I always like to be some practical. If you put on Pericard 6, I like to use this Serine needles before treatment. It's very helpful for nausea and vomiting. Been researched.
Yes. Thank you.
You're welcome.
Thank you. Thank you. Now, I believe that Beta Popkin has a question. Beta, if that's the case, could you please unmute and ask Dr. Yair Maimon your question, please? Beta, are you there? Okay, I don't think that you are there, so I'm going to go now to Kristen Ackerstrom. Hopefully I pronounced your name correctly. You had popped a question into the Q&A box. Could you please ask your question?
Yes, I can. I'll see you.
Hi, Kristen.
Yeah, I wonder how would you treat tumor fever on a patient with spread cancer the patient will not have any more Western treatment. So,
tumor? Sorry?
Yeah, tumor fever.
Like neutropenic fever?
I'm sorry, my English is not so good.
Okay.
He has, you know, full what you call metastatic
cancer.
Yeah, spread cancer, and they will not treat anymore. And he suffers now from very much fever.
Okay.
So could you treat the gene deficiency, or how do you treat, and how often would you treat?
Okay, so as with medicine, you know, we have to do like a differential diagnosis. Many cancer patients have what we call neutropenic fever because the neutrophil goes down or the Qi and Wei Qi go down. Some will have fever because of infection, you know, then we need to take out the heat. So it depends, either tonifying Qi, tonifying Yin, or taking the heat. Let's say, put it into 3 simple categories. And that can be determined by the pulse, the look of the patient, like if the fever is more at night, if it's with sweat, is it better during the day? It's a low-grade fever, high-grade. So all the things that I think you know also from your Chinese medicine diagnosis.
Yeah.
So you need to differentiate. You know, not like, I can't say there is like one point. So obviously if it's a fever, but that's...
How often would you treat?
You can even treat every day or every other day.
Yeah.
If he's metastatic in the kind of very advanced stages of cancer, I would treat every other day and not use more than 2 or 3 points each time.
Okay.
And you can do even shorter than 20 minutes. And it's effective, you know.
Okay.
But as I said, it needs to be a little bit of differentiation diagnosis.
Well, thank you so much.
Thank you. Thank you. Now, let us go to Carlos Cordeiro. Hopefully I pronounced your name correctly. Could I ask you to unmute and ask your question, please? Carlos, are you there, Carlos?
I can see him. It's different people. I can see Carlos down, just their picture. Maybe
Guy, are you able to unmute Carlos Cordeiro?
No.
Okay, I don't think that that's possible. Oh, okay, I've just had a message. Carlos isn't in a place available for a microphone. So I'm going to read out the question that Carlos put into the chat box. So Carlos put in, the Sloan Kettering Integrative Medicine Center Director has commented in a personal communication that they hold a belief that the poor cancer results in treatment in China is due to patients taking Chinese herbs and the purported ensuing herb-drug interactions. Do you have any comment on that?
I know Jun Mao. I mean, he's the head of the integrative oncology program in Memorial Sloan Kettering. I would like to see the comment, you know. So it's difficult to answer without seeing the comment. I mean, I have at least 3 or 4, there's actually been 3 or 4 big research, kind of retrospective research in breast cancer, which showed that patients who took Chinese herbs together with chemo did better for survival. So at least the one that I have from Taiwan, which are quite big, it's in each one there's like 800 people, 500 people, some cohort I think of maybe even thousands people, had shown that actually specifically that was, and there's one for lung cancer that is published in Lung, people was taking lung, cisplatin and herbal medicine, they actually survived better, did much better. So I've seen the research which are showing that the integration of herbal medicine with conventional medicine had actually proven to be very good, both in reducing side effects, but in some studies we also see better survival. So I don't know on what is the comment based on. Usually it should be based on some research, or usually you don't give a general comment. So, but you can send me the quote. I can take a look at it.
Brilliant. Dr. Yair Maimon, thank you very much. That is all we have time for today. Thank you to all of you who've joined us on your Sunday. Thank you very much for that. Thank you for all of your wonderful questions, your inquiring minds, and also your energy, because this has made today's session very, very special. I hope you have a wonderful rest of your day. Last word to you, Dr. Maimon.
I want to thank you, Kevin, and Guy and Patty, who were helping to put up this. So thank you very much from my heart, and thank you for being such a great host. Thank you.